audits nationally had shown what a low take-up of screening opportunities there were by people with learning disabilities. And in particular, breast screening had a really low take-up. So we did a scoping exercise and we found that 5 years ago, only 17 ladies with a learning disability in Walsall were screened. And that is obviously a very, very low proportion of the ladies of appropriate age who should have been screened or who could have been screened. And so that gave us some idea of the gap that we were aiming for.
There was a lot of evidence about people with learning disabilities and other disabilities not being able to access both the facilities for screening, but also not actually understanding what the whole process was about.
If you don't know anything about the question that I'm going to ask you, I want you to stand at this side of the line.
What we realised, or what I've realised, working with the Learning Disability Service, is that sometimes systems and processes and procedures are such that they actually do end up discriminating against somebody.
We needed to know why people weren't attending, and the team did a lot of work in, really it was about talking to people about why they weren't going. And there were lots of reasons that came out, but one of them was a great fear of the unknown. Again, no surprise, because we're all frightened of the unknown. But for our clients who often can't read the written word and often haven't had the same health education in school and at work and in the media that we can readily access. So we needed to concentrate on helping them to understand.
Now, I think I know a lot about breast screening, so I'm going up this end, right? We're just going to go and fetch some of our ladies and bring them to the session this afternoon. Sometimes that goes down really well because it gives us a chance during the car journey to talk one-on-one with the ladies and identify any concerns or apprehensions they may have about the health session before we actually start. The biggest barrier they had was actually access. The mobile screening unit is an excellent service for women who are fully mobile. But if you've got any mobility issues, which a lot of our ladies do, a lot of them are wheelchair users, they just couldn't get in there. So they would turn up for their appointments, couldn't actually access the service, and so they had to go away. And that appointment would be recorded as a DNA did not arrive, because that is the only system that was in place at the time. Many women didn't arrive at the appointments in the first place because when the letter came through, it was too complicated for them to understand. They had no comprehension of what the breast screening service was. Or when the appointment came from the hospital, it gave them a lot of fear, again, because they didn't understand what it was, and it worried them to such an extent that they didn't go in the first place. So our DNAs were very, very high.
When we first had our letters, we didn't understand, so we got in touch with somebody that we know, Leslie, and then we've been working with, and I explained the letters, and then we went along to the manor because the mobile one is now good for people with learning disabilities.
2 teas now, sugar, Sue.
The appointment letters that were being sent to women with a learning disability were the same as those that were being sent to everybody for breast cancer screening. And we soon realised that that letter wasn't appropriate. There was a lot of text in there, there were lots of big words in there, there wasn't clarity on what the procedure was about. So one of the initial things we did was to develop an easy read letter, which was made up of pictures and photographs and illustrations with 1 or 2 sentences describing what was going on.
Breast screening, 50 years to 70 years. All right. What is breast screening?
The nurse over there put these 2 things down the side of your breast, one at a time. And I could take a photograph.
What's different about this particular project is the focus and the methodology, and the fact that the reporting back kept us on track. We needed results, and we needed to see outcomes.
We worked with the radiography and breast screening service. We first enabled them to identify who our population group were, because the only information they'd got was the lady's name, address and GP details. Nowhere did it say that this lady has got a learning disability or mobility issues. So we put all that data into their database. So the ladies were supported. One of the most important things we were enabled to do was to offer pre-familiarisation visits to the unit before.
Well, I was scared at first because I didn't know what was happening, the same as Doreen. But we found that me and Doreen now and some of the other girls who have had it done, that we can now support other people. And we can say to them, don't be scared. You know, you've got to have somebody there to explain with you. But now we know that we've got all the support here off the team.
You're coming up with me, right, okay.
We scheduled the appointments not to be held at the mobile unit, but to be held at the static unit, the hospital unit. This gave us a lot more room, so if mobility issues were a problem, they were immediately eliminated because access to the hospital is ideal for everybody. Support workers and care workers or family members and friends could go with the lady because, again, there was plenty of room. And what we tried to do was initiate some group sessions, group clinics, so we could take 3 or 4 ladies in any one time. And this gave the ladies peer support, which is very important, because once they saw that one person in the group had gone and it had been okay, the rest were then happy to follow. And it became a bit of a competition, and we had some really good sessions, coupled with tea and biscuits. It made it quite a good social activity, as well as being, you know, a great healthcare initiative as well. Sometimes after the session, when we're taking them home, again, we can reflect on what we've talked about in the session. And quite often some of the ladies will disclose different parts that they found interesting or worrying about their health, which the nurse can then address. So it can be quite beneficial at times.
It really is a question of hearts and minds. We need to instill in people in the NHS that the will to want to change things, and then to apply their minds as to how things can be changed. And I think what Pace Setters has told us is that these small, reasonable adjustments that are brought about within the NHS can change things massively.
I think what Pace Setters has given us are tools to carry on with the work that we've done in a more focused way than we did before. I think we've got better at evaluation. I think we've got better and more innovative about getting messages across. I think we've got better at listening to our service user group. And that is innovative in itself, because I attend a lot of groups, a lot of meetings, and learning disabilities have got a reputation now for gathering service user views. And I think we've got better at that, we've got more innovative about that. And people's health knowledge has improved.
What I have observed is that you have a group of service users who are empowered to take up the service, which they weren't before this project took place. They seem to be, to me, to be empowered to expect better levels of service. Actually, they're very good evaluators, because one of the things they asked Professor Springett when she came for the evaluation in December, one of the service users asked her, "Tell me, Jane, what's the most important thing you're taking away from today, and how will you use it?" Which is a classic evaluation question, and this was unprompted by Doreen, one of the service users. So I think it's sort of capturing that sort of, that's an impact. I'm fairly sure that she wouldn't have asked a question like that before she'd been involved in the Pace Setters project.
If we don't now, somebody's going to die from it, and we've got to put the message across to people. And people should know. Learning difficulties. Don't know about more about that, really.
That is the message of that project. And you've got the service users giving the message. So in terms of evaluation, I don't think you could say anything finer than that.
After 2 years of Pace Setters work, that we now have 160 ladies who are registered for breast screening. And in quite a short reference period, we got figures as high as 100%. We were able to get staff to buy into this is an approach which works and makes a difference. Importantly, the people with disabilities, the patients, also bought into the brand and they associated the brand with trying to make improvements and reasonable adjustments. So Pace Setters over the 2-3 years or so has really developed into an approach that people recognise, support, and importantly as a manager, that staff want to get involved with.